You got this one drug. On the one hand, it can be a miracle, a genuine lifeline for someone in agonizing pain after an injury or a major surgery. But on the other hand, it's a substance that has fueled a devastating epidemic of addiction and loss. Today, we're diving into the two faces of hydrocodone, the powerful medical tool and the dangerously addictive opioid.
So here's how we're going to break it down. We'll kick things off by looking at what hydrocodone is supposed to do as a painkiller. Then we'll get into the really cool science of how it actually works inside your body. From there, well, the story takes a turn. We'll uncover the hidden costs, like addiction. We'll look at the ultimate danger, overdose. And then we'll wrap up by exploring the massive effort to try and contain the risk of this incredibly powerful drug.
All right, first things first, why does this drug even exist? What was it actually designed to do? Now, the name hydrocodone might not ring a bell for everyone, but I guarantee you've heard of these: Vicodin, Lortab, Norco, right? They're some of the most widely known prescription painkillers out there, and hydrocodone, well, that's their star player, the key active ingredient.
So what exactly is this stuff? Simply put, it's a powerful opioid pain reliever. It's actually derived from a substance found in the poppy plant. But here's a really crucial detail you should know. Doctors almost never prescribe it all by itself. It's usually combined with something like acetaminophen, which, is the main ingredient in Tylenol. And that's a 2-for-1 deal. It boosts the pain relief, but it also acts as a kind of deterrent. If you take too much to get high, you risk serious liver damage from all that acetaminophen.
So here's the deal. Hydrocodone is really meant for managing pretty severe but acute pain. Think short-term, intense pain, like right after a major surgery or when you break a bone. It's not really designed for long-term chronic problems like arthritis, and that's because the longer you're on it, the higher the risks of dependence and addiction just become.
So how on earth can one little pill have such a huge effect on pain? It's pretty amazing, actually. And the answer is deep inside our own nervous system. It's all happening in the brain and spinal cord. Okay, this is where it gets really cool. So first, the hydrocodone molecule is like a key that fits perfectly into these special locks in your nervous system called mu-opioid receptors. It's basically hijacking the same system that your body's own natural painkillers, endorphins, use. Once it's locked in, it blocks the chemical messengers that are screaming pain up to your brain. But wait, there's more. It also flips a switch in the brain's reward centers. So it doesn't just block the pain, it actually changes how you feel about the pain, making it way less upsetting. It's a real 1-2 punch. This quote is the perfect way to think about it. The drug doesn't just cut the wire to the alarm. Instead, it turns down the volume on those pain signals, taking what feels like a piercing shriek and turning it into a faint, distant whisper.
And this is a huge but, that powerful relief comes with a serious price tag. We have to turn to the darker side of this drug now, and we'll start with the side effects that can happen even when you take it exactly as prescribed.
And we're not talking about rare stuff here. Even if you're following the doctor's orders to the letter, these side effects can be a big deal. Drowsiness and dizziness are super common. That's why they warn you not to drive. A lot of people feel nauseous. And well, let's just say constipation is pretty much a guarantee when you're taking opioids. Okay, listen up, because this is probably one of the most misunderstood parts of this whole topic. People use these words, dependence and addiction, interchangeably, but they are not the same thing. Physical dependence is about your body. It just adapts to the drug and needs it to feel normal. If you stop suddenly, you'll go through withdrawal. Addiction, on the other hand, is a brain disease. It's that compulsive drive to get and use the drug, even when you know it's wrecking your life. It's entirely possible to be physically dependent but without being addicted. But as you can imagine, the two very often go hand in hand. All right, so beyond the side effects and the risk of addiction, we have to talk about the absolute worst case scenario, the most severe danger of this drug, the very real risk of a fatal overdose. And to really get how serious this is, you need to know about something called the FDA's black box warning. This is not your average, everyday warning label. This is the most severe, most urgent warning the agency can issue. It's basically the FDA's version of a skull and crossbones, reserved for drugs that carry major risks of death or serious injury. So what's in hydrocodone's black box? Well, it's a laundry list of deadly risks. First, of course, is the high potential for addiction, abuse, and misuse. Second, and this is the big one, the primary cause of fatal overdose is life-threatening respiratory depression. That's when your breathing slows and then just stops.
Third, a terrifying warning about accidental ingestion, because a single adult dose can actually be fatal to a child. And finally, a reminder about the risk of severe liver damage from the acetaminophen it's mixed with.
Okay, so knowing the risks is one thing, but what does an overdose actually look like? How would you recognize it if you saw it happening? This is critical information.
Pay close attention here, because remembering this could literally save someone's life. It's called the opioid overdose triad. 3 key signs. Number 1, breathing. It will be dangerously slow, really shallow, or maybe it's stopped altogether. Number 2, pupils. Look at their eyes. The pupils will be tiny, like the point of a pin. And number 3, consciousness. The person is unresponsive. You can't wake them up. If you see these 3 signs together, don't hesitate. This is a medical emergency. Call for help immediately.
But here's the amazing part. In this incredibly dark situation, there is a ray of hope. There is an antidote. You might know it by its brand name, Narcan. Its generic name is naloxone, and it's a genuine miracle drug. It can literally pull someone back from the brink of death. Basically, it works by kicking the hydrocodone molecules off of those receptors in the brain, and that immediately reverses the overdose and can restore breathing in just minutes.
So, as you can imagine, the widespread misuse of hydrocodone and other opioids sparked a massive public health crisis. Something had to be done. The government and the medical community had to step in and try to regain control. Remember this year? 2014. This was the turning point. In direct response to the opioid crisis that was just exploding across the country, the U.S. Drug Enforcement Administration, the DEA, made a huge change to how hydrocodone was handled. So what did they do? They moved hydrocodone products up to a much stricter category called Schedule 2. And the rules changed, like, overnight. Getting a prescription suddenly got a lot harder. No more automatic refills? Nope. Patients needed a new physical written prescription every single time. Doctors couldn't just phone it in to the pharmacy anymore. And on top of all that, the DEA put strict quotas on how much of the drug could even be manufactured in a year.
You know, this quote really just hits the nail on the head. It sums up the whole story of this drug perfectly. Hydrocodone lives on this constant, dangerous tightrope. On one side, you have its incredible therapeutic value, and on the other, the ever-present potential for absolute catastrophe.
And this all leaves us with a question that's so much bigger than just this one drug. The story of hydrocodone is really the story of one of modern medicine's greatest challenges. How do we treat severe pain effectively and with compassion, while at the same time protecting people and society from the devastating fallout of addiction? It's a delicate balance, and honestly, it's one we're all still struggling to find.